Welcome back to our program, and in this segment we're going to be talking with Mary Poole. Mary Poole is the Director of Quality Management, and she's going to be telling us about a recent Joint Commission recognition. Mary, welcome back.
Thank you, Barb. It's great to be back.
Well, we always enjoy hearing what you tell us because I think it makes us feel safer and understand care a little bit more. So let's start with the top and say, what's the Joint Commission?
The Joint Commission is like the good housekeeping seal of approval for probably well over 20,000 healthcare organizations across the country. Their accreditation and certification programs are known nationwide, and their focus, it's a nonprofit organization, and their focus is to make sure that everyone gets the safest, highest quality care.
So when we're talking about this recognition today, what are the diseases or conditions that were included?
Getting the recognition as a top performer in key quality measures is actually a recognition that has to do with carrying out certain treatment practices for certain types of diseases, for example, like heart disease. They have quality measures around heart attack care, heart failure care, pneumonia care, surgical care, VTE, which is actually blood clots, so it'd be the treatment for blood clots, perinatal care, psychiatric care, even pediatric asthma.
So when you see a key quality measure that measures a treatment process, can you tell us a little bit more? Does that mean that there's a certain number you're trying to hit or a certain process you're supposed to follow?
Okay. A key quality measure would be around a treatment process that research has shown is the best way, or you could call it like a best practice, an evidence-based best practice, that these are the kinds of things that need to happen in order to ensure or have better survival around a disease state.
So we've been talking about heart attack this whole program. Can you apply that to this?
Sure. For example, a heart attack patient, what a critical item or a critical process that needs to happen for a patient that's having a heart attack would be, get that patient into McLaren Port Huron, into the cath lab to open that artery as quickly as possible. That's one of the key measures that the Joint Commission tracks, or the data. We send data to Joint Commission on that treatment process. Another example would be heart failure, which is another heart disease, chronic type of heart disease. Some of the treatment practices around that to make sure that the right diagnostic tests are provided, like an echocardiogram, which actually that test kind of just sees how well the heart is functioning. And based on that information that comes from that testing, the patient gets the right types of medication and the patient gets the right kind of education.
So why does the Joint Commission do this? It seems like a lot of effort.
Well, it's a way to encourage hospitals to improve their practices, to continuously strive for excellence. And in our case, being recognized as a top performer in key quality measures, it's showing us that we have kind of achieved excellence in heart attack, heart failure, pneumonia, and surgical care.
So this is not mandatory for hospitals to collect this data?
No, it's not. Actually, it's not mandatory to be accredited by Joint Commission either, but it is a way in which to get information on how well we're treating our patients and identify ways to improve the care of our patients. So no, it's not a mandatory practice, but we send this data to Joint Commission.
So if I would say to you, Mary, it's not mandatory and you've got so many other things that you're working on, why would a hospital do this?
Well, my question back to you, Barb, would be why wouldn't a hospital do this? Because, we always want to improve what we do for our patients. And participating with accreditation, participating and sending data to Joint Commission, it enables us to get feedback on opportunities for improvement. Our clinicians are fabulous in that they look at this data, they analyze it to identify ways, how can we do things better? You know, or what didn't work and what do we need to improve so that we can consistently provide high quality care to our patients.
Well, as I said at the beginning, every time I talk to you, I feel a little safer. I feel hopeful that clinical outcomes are really, really good. Do you have closing comments for our viewers?
Well, just that. I mean, we feel we're really excited that we got this recognition as being a top performer in key quality measures, but we're not going to rest on that. There's always opportunity for improvement, so we're going to continue to look for ways to do things better for our patients.
Well, congratulations and thanks for joining me.
Thank you, Barb.
And thank you for joining us. Wow, this is great news. If you have any questions about this or anything else we've talked about today, you can always call us at Health Access. That's 1-800-228-1484. You can go to our website. It's full of information. That's mclaren.org/PHTH. And please join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health.